Christian, you're live. Hi.
Hello.
Hi. It has been a day. Oh
always.
my gosh. It's been a day. You'd think the kids had not had time off since March, and then it's been a day. Hi, I'm Nicole from Woodley Foot and Ankle, and this is
I'm Dr. Woodley, Foot and Ankle.
All right, so let's just get to it because this is a big topic. We're talking about diabetic insoles. We had started talking about it last week, and this is a new program. Well, it's not entirely new, but this is kind of new for our practice, where you're able to have an insole where you can monitor our patients' feet, particularly ones who have diabetes, neuropathy, that sort of thing.
Yeah. And
I've shared this story with you before, but when my mom was sick and when she was dying, she was bedridden. And she was also a brittle diabetic. And this was, years ago, we're talking 30 years ago, but still, she would have these awful wounds on her lower extremities. And when she, even, a few years before that, she had lost, because she got in a wound on her toe, like right in there, she had lost the tip of her toe because I think she had an ingrown toenail and it turned into a wound, and she had just become a diabetic at that particular time. So I'm like really excited about this program because this is something that, that can help our diabetic patients avoid having wounds, because as you know, and as a lot of our friends out there know, that sometimes those wounds can turn into something a lot worse. And what we want to avoid is amputations. I mean, that's just not good for anyone, but it's especially not good for people who have mobility issues as it is. So I'm going to stop talking and I'm going to let you talk about Orpyx. I got the handy dandy phone here when you're ready for it.
So this is our new insole. We have a program that is specifically for our diabetics, which is very exciting because, one, this device is a remote patient monitor. So this will measure temperature, pressure, and what that means to the diabetics is that those diabetics who get increased temperature, increased pressure, those are the ones that get ulcerations. Ulcerations basically sores, wounds. Diabetic neuropathy is the #1 cause of people losing their legs and ultimately succumbing to diabetes, because what happens is most people don't know that after you lose a limb,
I told you it's been a day. Our phone even wants to pause. Okay.
There is a almost 60 or 70% chance your 5-year mortality, you're not going to be here in 5 years, and that's higher than most cancers. So these are important because they measure, basically they're able to tell us that, all right, there's an increased temperature or something's going on, you need to go to your podiatrist, or you need to go see your doctor, or you need to look at your foot and evaluate it, because as you know, people who have neuropathy in particular can't feel. A lot of them have retinopathy, so they can't see, so that's why you got to go to your eye doctor. And of course, their body is their ability to fight infection, the ability to repair is blunted from that diabetes, from that high blood sugar. So these are a way, they fit in your shoe. Good thing they're covered by most insurances. They fit in your shoes. So they're like a regular orthotic device that fits in your shoe. And it will monitor your foot, which is really exciting.
How does it do that?
There's pressure sensors in here, and there's temperature guides in here. So this phone right here.
Okay.
So this phone is something that you carry around with you, and it has a program on it, and you get an alert if there is an increased pressure, increased temperature. But even if you don't see this, it will come to our office. We have some software that we have a list of people who are on this program. And we are able to basically see those error codes that are popping up. Hey, there's increased pressure on Mr. X's heel, and we will call, especially if you don't clear it, we will call you and we will say, hey, we think you need to come and see us or take a look at the bottom of your foot, maybe call in for a telemedicine visit, and we could look, and if there's an issue, we could jump on that issue before it becomes a problem.
So this phone is specifically for
this.
For
That's
this.
right.
So you're not, calling your grandkids on this.
No, you're not
Okay.
calling your grandkids on this.
All right. And then I noticed back here that there is a little USB port.
Yeah.
How does that work? I'll take
So the USB port is just a charger. So that's one of the bad things about this that I find is a little pain in the neck for some certain people is at nighttime they have to charge them, it won't
This
transmit.
is a phone charger.
Yeah,
That's
it's a
the
phone
wrong
charger.
one.
But there is a charger.
Oh, I got it. It's right here. There we go.
So
is that
basically this plugs in and you put it on the floor, and there's a little magnet when it's on the floor, and you see how it just plugs right in there,
Oh,
just like that.
you don't even have to try to get it in. It just kind of sticks
It sticks in there, and you just keep it on a flat surface.
And then you put this.
And you
Oh
plug
wait,
it in the wall.
it does both at the same time.
Yes.
Oh well, that's smart.
Yeah.
So you just put both of them on the floor
And
like that, and then you just plug this into the wall.
Mm-hmm.
Now, how long does it take to charge?
I'd say about an hour,
Okay.
yeah, something like that. But most people you put it at nighttime and just let it sit overnight, just like that.
All right.
Straightforward.
And how long do you have to wear these all the time? How does that work?
I recommend wearing them all the time, but sometimes they're a little bit thick, and some people have they want to wear a certain type of shoe that this won't fit in. So I would say a good portion of the time we'd wear these. And the good thing about these are diabetic insoles, so they're nice and soft.
Soft, and they're flexible.
And they're not entirely flexible. They're specific. They're custom. Yeah, they're custom to you. So we take a digital mold of your foot. So it's not like an off-the-shelf insole. I mean, it will match your arch. It will offload if you had a prior wound somewhere. We could offload it. So there's a lot of different things. That's why I love this product. This is the future. This is how we're going to beat that diabetic wound, amputation, infection, all that stuff. This is how we beat it. This is how we keep our legs and our feet, and we stay here and our independence. So we're not off of our feet. This is one of the tools that we have, which I'm really excited about.
Now, do you find your patients are compliant?
So, just like anything else, this is a team approach. I do my part, monitoring, and the patient has to do their part, wearing it and charging it. That's the thing. But I think it's in the grand scheme of things, this is an easy trade-off that you got to plug it in and charge it, because guess what? You're protecting your feet. You are avoiding trauma. I mean, people don't realize how devastating diabetic wounds can be. I mean, from just the infection, being in the hospital, the IV antibiotics, the wound changes. They sometimes even have a smell, and sometimes that is a problem where you don't want to go anywhere because you have this wound that smells. I mean, it's horrible, but that is the reality. That's why I love this thing. Most people don't know. They think you just have a diabetic wound, but it's not that simple. It has it has a psychological component to it, where you don't want to go out because of that smell, or you're limited because your independence is taken away because you can't walk on it, or if you walk on it, you're going to wind up in a hospital. There's just so many things that we could avoid with this little thing right here. I wish I had have come up with it, because I wouldn't be talking to you guys right now. I'd be on a beach somewhere in Belize, but I'm here now. So
well, he'd still be pushing his product. So yeah, he would be. He would
over
still
Skype,
be.
yeah, or Zoom,
or over Instagram.
Zoom something. Yeah, it wouldn't be right here. No, I'm joking.
But I think also, the less, not that we don't love seeing our patients, but if we can not see the patients because of the wounds, that's the less time the patient has to spend in a doctor's office or treating the wounds, where they can spend more time, being on a beach somewhere, or going mountain climbing, or spending time with their families, or just enjoying their retirement, or if they're still working, being able to go to work and have a life where they're not worried about, worried about a wound that's on their foot that is not healing. So good on you for finding these. I don't think I have any other questions about this. I think you covered it pretty
So
pretty thoroughly. Was
I'll
there
add
something
one
else?
more thing. So of course, shoes. And one thing that we can do, especially with our diabetics, we can, sometimes the insurance will actually cover diabetic shoes that are not the old clunky shoes, but look like regular sneakers or dress shoes. So I mean, there's other things that you can do that are appropriate for
We got a
this
question.
device.
It says, has the patient to high theory of nails, the patient has to be mobile, correct? All right, that's a good question.
So another thing, so the patient does not have to be mobile because, which we didn't mention today, but there are also socks that have the same monitors in them, built in them. So again, covered by insurance. You could put these socks on and they will actually monitor the whole foot and ankle for any increased temperature. So they do what these insoles do, but it's just a sock that you wear. I like the insole because I could also correct any, if you have a flat foot or if you have a metatarsalgia or something, a plantar fasciitis. These insoles are regular custom orthotics, but we do have other options for those people who are not mobile or who are in the bed. If you have a parent who's in the bed for some reason, they're developing pressure wounds on the heel is a big one. That's where the socks come in.
Okay. So, and for type A people like me, can you do both? Can you wear the socks? Because I mean, I'd have the sock on and the shoe, and because I wouldn't want any wounds. Can you do both at the same time?
Yeah, I'm sure you can do both. I would say it's patient's dependent.
So you can do both of them at the same time?
It's possible.
Would you get the same results?
Yeah, I don't see
Okay.
why not. You're just it's just giving you more monitoring.
Okay, awesome. Well, I am actually really excited about this program and excited to, not have, our patients that we love
Lose
dearly
limbs.
would lose limbs
That's right.
and not have wounds. So that is going to wrap it up for us today. I don't have any idea what we're, again, that is our day. Stuff just keeps coming up.
Isn't that person right here?
Yes, that person is here, but I have not had a chance to tell the calendar that I've already achieved what the calendar keeps saying that I have
Gotcha,
achieved.
gotcha.
Yes, I picked her up from school. I did that already. Phone, I did that already. Fix that. But anyway, that is going to do it for us today. I have no idea what we're talking about tomorrow. So if anybody out there has any suggestions, not tomorrow, good Lord.
Next week.
Next week, what we're going to be talking about next week, hit us up, leave questions in the comment sections if you have questions, if you've got suggestions about, some other topics you'd like for us to discuss, let us know. We're happy to hear from you guys. Thanks for liking and sharing our videos, and you guys stay safe out there. Wash your hands, hand sanitize, mask up.
Look at me when you said that.
What? Hand sanitize?
Wash your hands. I touch feet all day, so what?
And you wash your
I do wash my hands.
mask up, and we will see you guys next week. Bye.
Bye. I thought she was back.
She is. She's back there.